Okay, so tetanus vaccination after trauma, it depends on the type of wound. Means it can be clean wound or a minor wound. And other classification of wound is all other wounds other than the clean and minor wounds, which can be contaminated, crushed, avulsion, puncture, or burns. Second is vaccination history. It can be person does not know or does not remember the history, which can be an unknown history, which is seen in at least most of the patient, which is 70%, or they have less than 3 doses. Other is in the vaccination history is more than or equal to 3 doses, but when was the third, that is last dose taken, which is considered into an account while vaccination history. Okay, and what vaccine to use in tetanus? What vaccine is which is preferred? If I want to say, if TD or TT, which one will you prefer? TD will be preferred over TT. Tetanus and diphtheria one will be preferred, not the TT one. But if TD is not available, then TT can be also given. Okay, so the adult schedule for tetanus vaccine is, let's say patient has a history of a trauma, irrespective of a clean wound or other type of wounds, that is contaminated, crushed, avulsion, puncture, or burn. He has a history of trauma, and maybe he does not remember the vaccination history. So we give 3 doses, and these 3 doses are given. The first dose will be given immediately, second will be after 4 weeks, and the third dose will be given 6 months after the second dose. Now we're gonna talk about if the trauma is clean wound, how do we give the tetanus, and what will be the scenario presenting with the patient. Let's say first case, patient has less than 3 doses, or history, he doesn't remember the history of his vaccination. What we do, we give 3 doses, and I told you 3 doses will be given. First dose immediately, second dose after 4 weeks, we talked about this just now, and the third dose will be after 6 months of second dose. The second scenario, patient has more than and equal to 3 doses of TD vaccine, but in a span of less than 10 years. Then what we will do, no vaccination of TD or TT. Scenario number 3, patient has more than or equal to 3 doses of vaccination, but more than 10 years, which he have taken this 3 doses or equal to, it has been more than 10 years. So in this situation we give TD or TT. Now in trauma is dirty wound, the first case, patient has less than 3 doses, or he forget the history if he took the vaccination or not. What we will do, we give TD or TT plus tetanus immunoglobulin. Now second scenario, if patient has more than or equal to 3 doses, but in less than 5 years he took that vaccination, then what we will do, no TD or TT. The scenario number 3 and the last one, if the patient has more than or equal to 3 doses, but the time span has exceeds more than 5 years. 5 years of whom? 5 years of the last dose, that is third dose. So what we will do, we will give TD or TT. One important thing I want to mention is that the tetanus immunoglobulin is not administered at the same site where the TD or TT vaccination is administered. Okay, so guys, if you like the video, please give it a like or subscribe, which will push me to make more videos like this. And thanks.